everyone, welcome to Synerzip's webinar. My name is Jill Hurston. I'm the Marketing Director for Synerzip, and today's webinar is Emerging Technologies and HIPAA Compliance, and I'd like to introduce our moderator, Pankaj Jain, who is our VP of Software Services. Pankaj?
Thanks, Jill. Good morning, everyone, and welcome to today's webinar. Before we get started, let me go over some quick housekeeping notes. During the webinar, feel free to ask any questions through the chat box on your GoToWebinar window. We will try to get your questions answered as soon as possible. Please note that today's webinar is being recorded, and tomorrow you will receive an email with a direct link to the recording and the presentation. With that covered, let me introduce today's topic and speaker. Our topic today is Emerging Technologies and HIPAA Compliance. And our speaker today it is my great pleasure to introduce our speaker, Stephen Wu, today. Stephen Wu is an attorney with Silicon Valley Law Group in San Jose, California. He advises clients on compliance, liability, security, and privacy matters regarding the latest technologies. The American Bar Association recently published his book, A Guide to HIPAA Security and the Law, second edition. So it is my great pleasure to introduce Stephen. Stephen, it's over to you now.
Thank you very much, Pankaj. And I want to thank you and Jill Hurston and Synerzip for presenting this program, putting this together, and giving me this opportunity to speak before you today. Thank you so much. So as we tackle this issue, I want to turn back the clock and begin by giving you a little feeling for what information technology was like in 2003. And I got this information from a service called TimeToast. But dialing back the clock, we saw back in 2003 that the dominant computing paradigm was Windows and Microsoft Windows and PCs, Windows PCs. And we had this is what cell phones and cameras looked like back then, relatively unsophisticated devices. And we were just beginning to have the Apple revolution of music players at that time. So the very first iPods were being released back around that time. We did have public key infrastructure for securing communications using confidentiality encryption and digital signatures, but it was relatively early on in the internet revolution, so it wasn't widely deployed. We were just beginning to have what we called application service providers back then. This is Salesforce, and we didn't even have this concept of cloud computing back then. Amazon Web Services was just beginning around that time. But why is all of this relevant? Well, we're talking about HIPAA compliance today, and HIPAA is the Health Insurance Portability and Accountability Act, and there was a security rule that came out, and the security rule talked about the administrative, physical, and technical safeguards that HIPAA covered entities and business associates need to have. We'll talk about what those terms mean, but this rule came out in February of 2003. So at the time that this regulation came out, you've now seen what the technology landscape looked like. And at that time, people talked about the HIPAA security rule as saying, now at last, in the healthcare field, we've got a set of controls that we can feel like we've got a comprehensive set of controls. We can look at everything that we have to do in order to comply. So unlike other laws like California SB 1385, they had a set of rules that you could implement. So there's specificity. The California law was something where you had, I'm sorry, AB 1950. So with AB 1950, it basically said if you have personal information of consumers, you have to take reasonable care to protect it. But reasonable care, what does that mean? Contrast that with the HIPAA security rule, where it had some detailed requirements for administrative, physical, and technical safeguards. And we'll talk about examples of what each of those means. But it was a detailed set of rules, and now people felt comfortable with it. But here's the problem. After 2003, things began to change. And we began in 2004. We had our first social network, MySpace, in January of 2004. We had Facebook that came about in 2004 that started. So all of a sudden people were sharing information on social media, including sometimes even healthcare providers taking pictures and putting them on social media. Workers putting them on social media. We had YouTube that came about in 2005 and Twitter in 2006. And all of this was before the iPhone came out, where all of a sudden people were using these smartphones in a much more consumerized way, where they're using the latest and greatest devices to be able to surf the internet, play music, play media, and send and receive email. Of course, we had older devices before then, but they were relatively unsophisticated before the iPhone came along, and the iPhone touched off this mobile revolution. Then we began to have things like Dropbox in 2007, where people were able to store information in the cloud instead of having it on local devices. And we moved to an era beginning of tablet computers with the iPad, advent of the iPad in January of 2010. And as you go further into what we've had since the security rule, now we have the Internet of Things, where we're connecting devices to other devices that can talk to each other. You may have sensors that are collecting information and allowing people to control those devices. So, for example, someone who's in a building management mode could control the heating on floor 5 of the building by changing the thermostat of the floor by using a control on a smartphone that's connected to systems that are controlling the heating, ventilation, and air conditioning system. Or we may have retail kiosks that understands when someone who has got a certain application on the mobile phone passes by, then certain ads are served up to that person. We're talking about connected vehicles, where vehicles talk to each other, or vehicles talk to infrastructure so that they can coordinate with each other, connected cars. We may have industrial control systems. We do have industrial control systems where from central locations you can control various types of robots and social and industrial equipment. And in the medical field, we'll be talking about the Internet of Healthcare things in a little bit, but you can use the Internet of Things in the healthcare context as well. And there's an exponentially increasing number of devices that are going to be connected to this Internet of Things, such that people are talking about within a relatively short amount of time, we might have 50 billion devices that are connected with each other, and the healthcare field is no exception. And when we're talking about the Internet of Things, understand that it could be a lot of different things. It could be something that is connected to the public internet, so that like a webcam, somebody could look at it from anywhere in the world by connecting to its IP address. Or it could be something that's connected to a closed network, like a hospital infusion pump, where it's presumably not going to be something that you'd want to put out on the public internet for anybody to control, but within the hospital environment, there would be a network where somebody could control that pump on a local basis. We could have sensors connected to a mobile device, and that mobile device could be connected by a cellular network to the mobile internet. And later on, you could have mobile sensors that connect later on in some other time period to a network-connected device, and thereby having this data collected in the field get back into an internet system. Or you could have unconnected sensors that where the data is collected later and later uploaded. So when we're thinking about the Internet of Things, there are all kinds of degrees of connectivity with all of those. Also, since that security rule came out, we have drones. Of course, unmanned aerial vehicles are now going to become commonplace. People are using them for commercial purposes, and including in the hospital settings, which I'll show you in a little bit. We have augmented reality. So this is Pokemon Go, this game where you can look through your mobile phone and you see that the landscape behind you, but there's this cartoon-like character superimposed on this reality. So people are using this for a game, but we'll see in a little bit the healthcare applications of that. We have the advent of driverless cars. This is a Waymo vehicle, the latest one, but Google, and then later on when it spun out, Waymo has been creating driverless cars. Now we have GM Cruise, we have Tesla moving towards autonomous driving and autonomous freight trucks. So we're moving in the direction of having robots controlling vehicles. So what about in the healthcare field? All of these technologies are starting to be deployed in the healthcare field as well. So telemedicine is one of these things that are coming to the fore now, where people can have essentially sophisticated video conferencing services, where a patient who is remote can be in contact with a healthcare provider and be able to get care and diagnosis over an internet connection. Of course, that internet connection needs to be encrypted, and you need to have the physical security of the devices being used for the system. But telemedicine is increasingly common, and another of the applications is, you can imagine, let's say a dermatologist who is in a big city is contacting some remote clinic up in Alaska, say, and there's a handheld device that can be put next to the patient's skin so that the doctor can look at the image of the patient's skin and be able to make a diagnosis instead of having to fly 4 hours or something into bush country in Alaska. So those are the kinds of applications that are very useful for telemedicine. Telepresence robots. So this is one of these applications where a doctor who's doing rounds can go out at 2 in the morning and be able to see patients with the help of a local nurse there, maybe even putting a stethoscope on a patient and making those rounds maybe from the comfort of his or her own home, and be able to be present at the hospital without having to actually travel down to the hospital, say in the middle of the night. So something like that. And this is also very helpful for Ebola patients. You want to minimize the number of people who actually have to go into the room. So this is another example of telepresence robots. And within the hospital setting, you could have delivery robots. This is a form of drone. The Tug is an example of a robot that can carry around supplies, blankets, and other things from one place or another to within the hospital environment. We also have increasing number of wearable computers where people are wearing these devices that keep track of things like how many steps you've taken, what's your heartbeat, how many stairs have you climbed upstairs or gone downstairs. So collecting all this health information is useful for healthcare providers, where they can see how patients are able to get exercise in the field and how healthy they are, and keep monitoring them in that way. So people are making use of these wearables. Patients are making use of these wearables to help their healthcare providers get more information about how their health condition is. Mobile EKG or ECG. You can imagine a device where in yesteryear you might have to have a doctor's appointment where the doctor says, okay, go have an EKG. You have to make a separate appointment, go to a separate location, and then probably pay another copay to have this test taken. Whereas this doctor could, inside the setting of the doctor's office, attach sensors to you and to a mobile phone and take this EKG right then and there without having that separate appointment, without having to pay the separate co-payment. I mean, it's a way for the doctor then to have instant results and be able to talk to the patient about what's going on. There are also internet-connected or sensor-connected blood pressure cuffs to collect information, all kinds of devices that could be attached to mobile phones. This 3D printing is a way by which you can have a device that creates parts or pieces, basically printing out material into a certain shape. And so the common example is you could create comic book characters out of plastic or something like that by this additive manufacturing where it sets it out layer by layer. And in the healthcare field, people are using 3D printing for printing out plastic parts or metal parts or ceramic parts, even tissue or food people are talking about. I had seen a particular use case that was particularly helpful of someone who had orthodontic surgery where the person's jaw was broken and moved forward in order to open up the airway to prevent sleep apnea. The doctor of this patient was able to take measurements inside this patient's mouth, send a file remotely to a remote manufacturing facility through the internet, and then the manufacturing facility created surgical guides out of plastic and mailed them back to the doctor. So there, the manufacturing facility was remote, had no contact with the doctor other than this internet connection, yet was able to provide a 3D printed device that was able to help out with the surgery. So that's an example of 3D printing use in healthcare. In healthcare, we're collecting enormous amounts of data and sometimes coming up with surprising conclusions about that. And you could do analytics of very large amounts of data, that have been collected very quickly and with a great variety of that information, all through cloud-based services. And in the advertising space, to give an example, advertisers are collecting huge amounts of data about how people are purchasing things. So the usual story people tell about big data is one in which a person bought a product in Target, and Target sent an advertisement to this person's home. This person was a 15-year-old girl, and the advertisement was about maternity wear. And the father of the person who was receiving it was very upset at Target, saying, "This my daughter's only a teenager. How can you be sending this maternity wear?" But Target had figured out that perhaps she was expecting, and in fact, it turns out that she was expecting, and Dad later on apologized, but it turns out that Target knew before Dad did that his daughter was expecting a child. So that's an example of what big data does. But in the healthcare field, you could have all this data from wearables and fitness devices being fed into databases where people who are doing research or doctors can figure out health trends among their patients. And people are mining old databases of medical records for help and diagnostic purposes. So big data is the era of big data is here, and it includes the healthcare field as well. Augmented and virtual reality, we saw the Pokemon Go, but there are actual applications of augmented reality in the healthcare area. So people were using Google Glass to help out in surgical procedures. Google Glass is something that you wear like a goggle over your eyes, and and when you're looking through it, it looks like there's some kind of extra image on top of the patient that you're seeing right in front of you. So you're seeing the actual patient, but then there's some information superimposed on the patient. And people are using that, for example, to guide surgery, where you might have an image saying "cut here," arrows or lines to help the surgeon know where to cut. So that would be an example of augmented reality in surgical procedures. People are using virtual reality, where it's an immersive thing where you put on these goggles like this doctor here, and you have some kind of training scenarios that the doctor is using to do a certain surgical procedure or learn how to use do a surgical procedure. Can be used for diagnostic purposes, could be used for telesurgery, doing surgical surgery through remote systems where the surgeon is somewhere else and using an internet connection to go to a local device to be able to perform surgical procedures on a patient. And you may have these goggles being used for therapeutic purposes, treating PTSD or phobias. Those would be examples of the healthcare use of virtual reality systems. And now we have artificial intelligence. The biggest example there is Watson, where Watson is being used to help medical care providers do differential diagnoses of patients' conditions, where it's crunching a huge amount of data and saying the chances are that this patient has X, whatever the medical condition happens to be, and lists out some possibilities of what the patient may have based on the data being fed to from that patient being fed to the system, and comparing it with what other patients have had, and maybe they've had similar conditions in the past. The AI system within Watson can help with that diagnosis of what this particular patient might have. So with all of these, there are security concerns with all of these, and we're now seeing the deployment of these technologies, and of course people are now worried about HIPAA compliance with all of these new technologies. We also have brain-to-computer interfaces where, in this particular example, you have researchers from the University of Washington. The researcher on the left has and the right have these sensors on these caps that they're wearing, and they're connecting their brains in this very primitive way. But what's going on there is that the one on the left is thinking, press the button, and the researcher on the right, without knowing why, all of a sudden his finger presses the button. So this is an example of this brain-to-computer interface where the the nervous system can be used to control information technology and can be used to create some effect like what we see here. This is just a very simple experiment, but over time we're going to have more types of devices that people put into their actual nervous system, maybe for Parkinson's treatment or Alzheimer's treatment, or maybe even human enhancement. But for whatever reasons, we may be interfacing specific devices with people's nervous systems. Another example of this is a neuroprostheses, where University of Pittsburgh, for example, has this device where a woman who's paralyzed from the neck down can use a device that's connected to her brain to control a robotic arm that can feed her with just her thoughts alone. So these types of neural devices or neuroprostheses are becoming more common. And why is all this happening? It's because computers are becoming exponentially more powerful over time. That you can see that the power of computing going up like an exponential curve going upwards. And that means that they can do more than they used to be able to do. They're more capable. They can throw large amounts of data or throw large amounts of computing power to do things that in previous decades we never were able to do. And as a result of this, we've got the possibility of synergistic effects among these multiple technologies. And we've got, for example, I'm just going to use one example, and it is outside the healthcare field, but I think it really shows it well. Imagine an autonomous vehicle. It's a robot. It may have connection in its in-dash systems to social networks. It's a mobile computer. It's connected to big data because it's receiving large amounts of data and throwing off large amounts of data so that people can see, oh, all these cars are going 10 miles an hour on this freeway. Isn't that, maybe something happened on the freeway. And the receipt of the big data is in the form of mapping information so that the car knows where to go. It's connected to the internet, so it's part of the Internet of Things. It's connected to the cloud. So cloud computing is in use with this car. It may have an augmented reality screen where you could see down the road there's this 4-star French restaurant in this building down the street. Let's go there. So you might have an augmented reality system on board. 3D printing, maybe not so much, but it's making use of privacy and security technologies, and people even talking about using connected cars to work together with your wearable computers. So if you're having, say, myocardial infarction, it knows to take you to the hospital, something like that. So all of these technologies are working synergistically in one device. And if you think that you could focus on just one aspect of it, well, it's a robot, then you might be missing out on something else in this bigger picture. So if the car crashes, it may not be because there is something that's wrong with the car as manufactured by the manufacturer. It may be because the data supplier gave incorrect information that was fed into the car that caused it to crash. It may be the big data supplier that was the cause of this crash. So you need to look at the synergistic effects among all of these. And whenever we're looking at healthcare technologies, we have to keep this in mind. So I've now taken you through this change that we've had since the HIPAA security rule came out. Since 2003, all of a sudden we've gone to this progression of increasingly sophisticated technologies, and it's putting pressure on the compliance efforts of healthcare providers and other covered entities and business associates that have to comply with HIPAA, and yet at the same time, there hasn't been a single change to the security rule to focus on these new technologies. We don't have new specific rules in the HIPAA security rule to accommodate cloud computing, big data, AI systems, augmented virtual reality systems. We don't. So now we're back to the situation where, like AB 1950 in California, where it says you need to take reasonable care to protect certain kinds of personal information. We're back to saying, okay, how do we comply with HIPAA with all these new technologies? And we have to focus now on what reasonable and appropriate administrative, physical, and technical safeguards there are out there to help protect the information that's being collected, managed, transmitted, and used in the healthcare environment. And we have to do it in a way that is in keeping with the letter of the HIPAA security rule, even though the rules haven't changed during all that time. So moving forward, there are, let me go through a few more things for you to think about before we dive a little bit more into security controls. With all of these, if you're a developer working on products that are being used in healthcare, you not only have to think about a compliance issue, you also have to think about liability issues. So the examples I give are, I'm taking again from the automotive space, but the point is that these are true for any consumer products or products that are put out there that touch consumers or patients in the healthcare field. You could have massive liability if you put out products that have defects in them. And the examples here are in the Toyota sudden acceleration litigation and in the GM ignition switch litigation involved with that. These are $4 billion plus liabilities. I mean, for any companies that were smaller than those major manufacturers, it could easily have put them out of business. And who could be the potential parties? Well, in any device, you can think of, these are the usual players who might be involved in the creation of an end product that's put out into use, and any of these could be potential parties, could be sued, in other words, if there were a defect in a particular product. But nowadays, with all the technologies that I showed you, these are the potential parties that could be brought in. You could have, in the automotive case, you could have the big data service provider that was at fault, the cloud hosting vendor, the one that was running the whole system, the infrastructure service provider. The security vendor could have been the one that was at fault, wasn't managing the security properly. So there could be new types of potential parties that in yesteryear we never would have seen. And when you are thinking about the types of claims that could be brought against these companies, these are the legal terms that you would see. Strict liability, meaning that a company that puts out a defective product into the marketplace could be liable for those defects, even if that company wasn't at fault, so to speak. Negligence, meaning that company was at fault, didn't take reasonable care to manufacture a product. Warranty, there's something that the company promised that it would do, that would have certain features or it would have certain safety, and then didn't meet that expectation. Or implied warranties, that it is good for the purpose for which it was purchased, something like that. We are now, when you see these types of claims, you see often fraud claims where the claim is that the company put out something knowing that it didn't work properly. And very common in these manufacturing cases, you have claims for unfair and deceptive trade practices. You advertised that it would do this, it didn't do that. Or you advertised that it was going to be safe, it wasn't safe. So these types of false advertising or unfair and deceptive trade practices are often used when, even in the absence of an accident, even in the absence of a bad event, the diminution in the value of the product is itself a form of damage. And then, of course, you could have security or privacy breaches that create their own compliance issues.
Yeah, Stephen,
So,
this is Pankaj.
yeah.
I wanted to interject, maybe you can touch later. So one of the questions that came up is like, what in this new technology world, what are the ethical implications where algorithms or machines, like what we talk about, like AI, are making medical decisions?
That's a really good question. Right now, I've been doing a lot of work at the intersection between ethics and law. And those two are distinct areas of inquiry. So law is looking at things like compliance and liability and governance. Is something legal or illegal? Is it a criminal act or not a criminal act? Is it against the law or not against the law? Could you be sued if you did this or that? Ethical is what's right or wrong, separate and apart from what the law says. And many times the law allows things that are unethical, and sometimes something is the right thing to do but may be illegal. You know, we talk about, say, you know, Martin Luther King's conduct, you know, and he ended up in the Birmingham jail, and he was going against the law, but what he was doing was for the greater good. So, you know, law and ethics are not the same. And I think we're now seeing a group of people come together to look at that intersection of law and ethics and say, what can we do from a governance perspective to think about both ethics and law in order to help inform our decision makers within a healthcare environment? And so people are talking about ethics panels, people are talking about panels that are interdisciplinary with lawyers and ethicists together in the same room to help come up with decisions about particular courses of action. And manufacturers would be a prime example of entities that could benefit from programs like that. So in the autonomous vehicle arena, for example, people are considering the ethical implications of programming autonomous vehicles. I see the same thing for any application of AI. And so I have been helping ethicists and facilitating this discussion to promote the use of panels or programs or interdisciplinary groups that can help manufacturers create programs that think about the ethical issues, think about the legal issues, and use those decision-making processes as a guide to figuring out what features should we use. Are there features that we shouldn't use? Are there things that we want this device to use or things that we want this device to avoid? Manufacturers can get important and helpful guidance from these different disciplines in creating a product that ends up in the marketplace.
Sounds good. Thanks.
So continuing on, we talked a little bit about liability, and one of the areas that we have to worry ourselves about is security concerns having to do with these devices. And the example that I would give would be the Hospira LifeCare Infusion system. This is a device that pumps medicine into people's veins. And a researcher named Billy Rios, I sat next to Billy Rios at a meeting one time. He was talking about a Philips X-ray device that he was able to purchase and was able to compromise with known vulnerabilities in Windows XP, the operating system at the time that was running it. And he said if this device had been in use and he had been able to compromise this device, he could have caused X-rays machines to deliver excess doses of radiation to patients and hurt patients. He found some vulnerabilities in this infusion system where he did some simple testing and found these types of vulnerabilities that you see on the screen here. I'm not going to go through all of them, but the point here is these are not problems of obscure security problems that only sophisticated researchers would be able to know about. These are the basics in terms of security vulnerabilities that manufacturers should watch out for. So when we think about security by design systems, where as a manufacturer you want to, from the very beginning, think about security as part of the process of creating this product, doing some risk management as it relates to the design of this product, thinking about what are the vulnerabilities possible in these devices, what kinds of controls could we put into place, what are the risks of these vulnerabilities coming to pass, what are the threats from them, and what can we do to control them. And we should be implementing reasonable controls to prevent these kind of vulnerabilities and test to make sure that our devices don't have them. It's apparent that this manufacturer didn't do the testing of these fairly obvious and simple security vulnerabilities to be able to detect them and to head them off before the product went out on the market. And as a result of this, the FDA put out a release saying, hey, watch out for these vulnerabilities. And so presumably by this time, they've all been fixed. But the point is that manufacturers should be thinking about these vulnerabilities in advance of putting the product out on the market. And why is that? Because people hack devices, and you're going to have attackers. When you create a product and you put it out in the marketplace, you have to figure that there will be people out there who will try to attack your device. And because that's foreseeable, you need to take steps now to prevent those problems from happening in the future. And what are the problems that could come about? Well, you could have, the interesting thing is when I did the Guide to HIPAA Security in the Law, I did a little survey of what the Department of Health and Human Services was concerned about when it was taking enforcement actions against certain companies. The number one risk that I found in all of these cases that Health and Human Services opened or concerning investigations of companies, the number one risk was the loss of device with unencrypted protected health information on it. So if we can encrypt our devices, the data on our devices, if we can prevent the loss of devices, then you will go a long way to reducing your legal risk when it comes to enforcement actions by the Department of Health and Human Services for violating HIPAA. The number two legal risk was improperly disposing of protected health information. And one of the examples that I would give would be a dentist who was retiring in the state of Indiana, and he was trying to get rid of his old medical records, and he left them out on his driveway, and somebody found out about it, and this dentist ended up being sued because of that. So that's an example of improper disposal. The Boston Globe did a story about finding medical records in a dumpster. You know, those are the kinds of examples that we're talking about. That ended up in an enforcement action against the people who had disposed of it. Now we're seeing the ransomware stories in the news these days. So ransomware is a big problem in healthcare. UK hospitals were affected by ransomware. In the past, US hospitals were affected by ransomware attacks. So malicious software, phishing, and another type of legal risk is HHS goes after companies that don't have business associate agreements with their business associates. So that's an easy one. If there's no business associate in place, and it's easy to prove you don't have one. So that's low-hanging fruit for the enforcement folks at the Department of Health and Human Services. So let's talk about, well, let's start here. So HIPAA, what does HIPAA require? Well, HIPAA covers covered entities, healthcare providers, health plans, and healthcare clearinghouses. So clearinghouses are entities that move data from one format to another, for example, in helping to do billing transactions or other types of transactions. Covered entities, healthcare providers, hospitals, pharmacies, doctors' offices, dentists, those would be healthcare providers. Business associates are those that are supporting them by doing some kind of covered function that requires access to protected health information. And I'll talk about what PHI is in a minute, but business associates are those that are providing assistance to the covered entities. And they may be like a billing company that would take patient records and help to collect money from patients. Or it might be a data service provider that's hosting information that's medical records, hosting medical records, and so has access to protected health information. So there are many, many business associates, and business associates have to have agreements with their covered entities by which they promise that they will provide reasonable and appropriate security controls to protect health information. So what is protected health information? Health information is information.
Stephen, sorry to interrupt, but a quick question between covered entities and business associates. So there are a lot of companies, small startups developing mobile health application. They are not kind of a device, but they are like for end user, right? They are just doing mobile apps, right, for digital health. So under what category they fall in? Because they are not like providers or doctor, physicians, but they are providing free app for digital health for direct end consumers, right?
Yeah, so let's talk about that for a little bit. They are not themselves covered entities or business associates, probably, unless it's like a hospital saying we're going to develop our in-house app, something like that. So let's assume that it's a separate business. That business is not itself a covered entity or a business associate. It's making something that could be used by a customer to be able to help out, let's say, with health diagnostics and treatment. But let's use two scenarios. One scenario is in which a health system says, we want to use that app so that we can gather information about our patients and be able to feed that information to our doctors so our doctors can provide advice to our patients. In that case, again, the developer itself is not the covered entity or the business associate, but the customer of that developer is a covered entity or a business associate. It could be the covered entity itself, where it's giving it to the health plan, say. The health plan's keeping tabs on patient health, and so the health plan's the covered entity is the customer of the developer. So the developer has to keep HIPAA compliance in mind, not because the developer itself is a covered entity or business associate, but because the developer's customer is the covered entity. It could be a business associate, it could be an outsourced service that does the data collection on behalf of a health plan or hospital system. And so the business associate is the customer of the developer. The business associate has to be worried about HIPAA compliance then. So it's the customer, the developer, that has to worry about HIPAA compliance. So HIPAA compliance is important because if the customer buys it and it's not, it doesn't protect information properly, the customer could be non-compliant then with HIPAA. But the other possibility is that if a developer creates an app that's used by a consumer to store health information and it never touches a provider, it's just as someone who's doing daily fitness or exercise, I want to keep track of my own health information. I keep track of it myself, and I store it in myself, and maybe I have a cloud-based account, something like that. That's the second scenario. There's no HIPAA issue at all because it's never going to a healthcare provider. So there's no HIPAA issue there. But there's still all the principles involved with HIPAA compliance are still relevant to that developer, because if the developer puts it out in the marketplace and it doesn't take proper care to protect that information, the developer could be subject to liability, not for facilitating the violation of HIPAA, but because the developer did something that constitutes unfair or deceptive trade practices.
And this, just to add to what you say, I think that's a good clarification. So you may not be the application as a business, small startup you develop today may not require HIPAA compliance, but if the data is used in future someplace with the provider, then it could be, you could be liable. So
right.
One should take
and sometimes you have an app or a device that you don't know where it's going to end up. It could be in the hands of a covered entity that's using for a fitness program. It could be in the hands of a consumer. It could be either one. So in that case, the developer has to keep in mind HIPAA compliance for both scenarios.
Sounds good. Thanks.
I'm sorry. So HIPAA compliance on one scenario, but the same kind of protections for the other scenario, even though it's not technically HIPAA. That's what I meant.
Okay.
So, we're talking about health information gathered about the diagnosis of the patient, the treatment of the patient, billing information. All of this is health information. If it's individually identifiable about a particular patient, and we're talking about mostly what that is, then it's individually identifiable health information, and subject to certain exceptions, it is protected under the law. So this is a category. When we talk about protected health information in the context of HIPAA, that's what we're talking about. So people throw around this term PHI or protected health information. That's what they're referring to. So HIPAA says you have to take reasonable and appropriate administrative, physical, and technical safeguards to protect protected health information. And what do we mean by administrative safeguards? Well, what we're talking about is, for example, training people in order to know how to handle PHI. So, taking reasonable care to prevent viruses and not clicking on phishing links. So there's a training aspect to it. Security awareness and training is one of the key aspects. Security management, who should get access to PHI? What kind of PHI should they have access to? When they leave the job, you need to cut it off. When they change jobs, do they need all of that access, or can we reduce their access? If they get promoted, do you need to give them more access? So there's a security management function. Security oversight, making sure that people are held accountable in case there are violations of HIPAA policies. Those are administrative. It has to do with the processes and with the people. Physical safeguards, we're looking at what kind of ways are we protecting the physical environment around devices or storage of PHI. So, for example, in a data center that's hosting PHI, you've got walls and you have guards and security cameras to protect that facility from intrusion, somebody walking in and walking off with a machine. For laptops and mobile devices, this is a big issue because you want to physically protect that device from somebody walking in and taking it. Some of those enforcement actions that I mentioned had to do with doctors who left a laptop with unencrypted PHI sitting on a desk, and somebody just walked in the door and took the laptop. Another, Sutter Health was victimized by someone who broke in and took a bunch of PCs out of the facility, and the suit by the patients affected was for $1 billion. They didn't get it, but that the physical protections are just as important as administrative protections. And then technical safeguards. So what we're talking about is things like firewalls, intrusion detection systems, even though those aren't mentioned in the HIPAA security rule, but preventing people from gaining unauthorized access using passwords, or better yet, more sophisticated forms of access control, encrypting information going from point A to point B, or encryption of data at rest. Those are examples of technical safeguards. So HIPAA has rules that have some level of detail about administrative, physical, and technical safeguards, each one of those. And those are all laid out in the security rule. Some of them are mandatory, meaning you have to do it. And some of them are what are called addressable, meaning you don't absolutely have to do it. Like encrypting information, surprisingly, is not an absolute requirement. But if it's not an absolute requirement, if it's addressable, then if it's reasonable and appropriate to implement it, you have to, which I'm thinking almost every single case would be the case. If you didn't implement it because it wasn't reasonable and appropriate, you'd have to document why not, And if there's a countervailing control that you could put into place that is reasonable and appropriate, you would have to put that into place. So I'm thinking as a de facto matter, given the connectivity of devices, given the way that devices could be stolen, it becomes almost a de facto requirement in terms of encryption.
Is there, in terms of encryption, is there any HIPAA defined standard in terms of like how many bits, like 128, 256, 1028? What's the minimum encryption I have to do if I'm developing a software from scratch?
Well, it refers to NIST standards. The HITECH Act makes a reference to the HHS coming out with guidance on encryption, and then the HHS has come out with guidance that references back to NIST standards on encryption of data at rest and data in motion. And so, you know, I haven't looked at it right before this program, but you can reference those standards to find out what the latest is in terms of what they're requiring.
Sounds good. Thanks.
So when we're thinking about security, you know, as a security professional, we think about confidentiality, maintaining the confidentiality of information so that it's not accessed or used, accessed without authorization, integrity to make sure that data aren't corrupted accidentally or intentionally, and availability. So we think about denial of service attacks as making services unavailable. We want to make sure that services remain available over time. That those principles of information security continue to be something that we need to think about in this era of emerging technologies. And with all of these technologies that we've gone through, we still need to do a risk assessment. I talked about that risk assessment process, looking at what are the potential vulnerabilities, what is their likelihood of coming to pass, how frequently do they come to pass, what would be the magnitude of the harm, measuring that against the controls that could prevent them or mitigate them, and what's the expense associated with those, and weighing those and figuring out what's reasonable and appropriate to implement in terms of controls to protect against those threats. So that risk assessment process should be true for whenever you're deploying the technologies that we talked about earlier in the program. That risk assessment should be the basis of what you're doing before you begin to deploy those technologies. When we think about bring your own device programs and mobile device management, we think about what are work versus personal assets. Sometimes those end up being mixed, so we have to keep the principles in mind of saying, are people using their work devices for personal reasons, or are we talking about personal devices having work information on them? So we need to make sure that we have control over the work information, meaning, you know, the protected health information, regardless of what assets they happen to be stored on. And training and awareness remain important. As we have more sophisticated technologies, we need to train people on how to use them and prevent threats that might come to pass. For example, I talk about physical security. Physical security you don't think of necessarily as being this big deal, but when you see all the lost laptops, you realize how important it is. Well, if you have a telepresence robot or a telesurgery system, you want to prevent people from going into the room where those are being used and tampering with them, for example. So physical security is just as important as protecting the device against malicious software or something like that. And so training and awareness is an integral part of helping people to reduce the risk associated with all those threats. In the cloud computing environment, again, you still need to do the risk assessment. Maybe cloud computing is not appropriate for some specific types of applications. And people can help you as a developer think about the different deployment strategies. Do you use a private cloud, use a hybrid private public cloud? Obviously, there's expense associated with private clouds, and so you have to weigh the expense with the risks associated with it. Doing vendor due diligence is just as important in the era of these emerging technologies as ever before. What testing was done on these devices? Can they show certifications? Those would be examples of things that you would look at as a purchaser of these systems. And in all of them, access management, you know, how do individuals use these devices, and trying to prevent this shadow IT, meaning unauthorized use of consumer services for work purposes. We have these mobile...
quick question, Stephen, yeah. Sorry to interrupt. On the certifications, in terms of BAA, are there any HIPAA compliance or security certifications which the law requires, like for anybody to go through? Are there any standards?
Not any required standards. I mean, that's one of the reasons why people are turning to high trust for getting some kind of certification, which is an entity that's taking information security controls from a lot of sources and putting out a certification program. But HIPAA doesn't have itself something that's mandatory like that. But you can go through this process of assessing your risk and then putting into place controls, administrative, physical, and technical safeguards. And what I've done with my clients is I provided them with a legal opinion that says, I've looked at the risk assessment you've done through these consultants, and based on that and my understanding of what they found and my understanding of your environment, is my legal opinion that you comply with HIPAA. So that's as close as I can come to something that's a certificate, but there's nothing official that's an output in the security rule like there would be for ISO 27001 or something like that.
Yeah, because the reason the question came up is if you look at the Google search, you will see a lot of companies providing you HIPAA certificate. If HIPAA certificate.
Well, remember, HIPAA certification for an individual, saying I've got this training, something like that. That's a separate thing than a covered entity or business associate getting a certificate like you would get from ISO 27001, the certification process there. So
yeah, sounds good.
Okay, so I won't go into detail because we're getting short on time, but I wrote this book called Enterprise Guide, a Legal Guide to Enterprise Mobile Device Management in 2013, which talks about managing the risks associated with mobile computing, the security controls associated with that. And these slides will be available for you, so we'll make sure that you get them. But these are examples of some of the security controls for some of these emerging technologies that still are relevant, even though it's not directly addressed by HIPAA. These are things that would be reasonable and appropriate to implement. And remembering all of these, we've talked a little bit about some of these, but supply chain is another thing that people don't really talk too much about, which is that when you're a component part, when you're getting component parts from other people or getting software from other people, you have to manage the risks associated with counterfeit parts or malicious introduction of malicious software into firmware or software. So controlling your supply chain is a critical part that sometimes people don't think about. But for developers that are trying to put devices out into the HIPAA compliance market, this is critical. Account security, meaning the online accounts that people have, are just as important. If you've got a system, for example, that's collecting Fitbit data that's associated, there's an online account associated with it, you have to protect the account as well as the device. And then capacity planning from an availability perspective. So we've covered a lot of stuff. If you have any further questions about this stuff, this is the book, A Guide to HIPAA Security in the Law. It's available from the American Bar Association website. And with that, I throw it open to additional questions.
Steven, one of the questions is that's coming is, can you talk a little bit about, is there a difference between user-generated health data versus clinical? What the questionnaire asks is people are wearing all these wearables, let's say Fitbit, right? That's my individual user. May or may not be generating some health data versus the data that is gathered in a hospital setting or in a doctor's office, clinical. Is there a difference?
Yeah, there is a difference. I mean, remember when we were talking about the two scenarios, if I'm collecting a lot of my own health information, I may even be posting it to social media or something like that, saying, look at all the steps that I walked today, or look, here's my heart rate over time. I can post all that. None of that has anything to do with HIPAA because there's no covered entity involved. There's no business associate involved. But that same device could be used by a covered entity or with the help of a business associate to collect all that information so that a doctor could help advise the patient on the patient's condition or the patient's compliance with instructions to do more exercise or to do more fitness activities. So a healthcare provider could use the same device indirectly by having the patient use it, but collect the information from that. And in that case, there might be a connection with HIPAA. If the healthcare covered entity created a program by which data is collected by a business associate, then it has to be protected as PHI.
Okay, sounds good. I encourage everybody to continue to send your questions using your chat box. While the questions are coming, Stephen, if you can go to the, unless you have anything else you want to say, otherwise we'll, yeah. So thanks, Stephen. This was a great presentation. I'm sure like everybody who is attending got a little bit more familiar about HIPAA compliance and if you're providing digital health solution. And hopefully you are a little bit feeling more comfortable and feel like it's not that scary of a thing if you take care of the basic stuff, which you can do. So in terms of questions, at this point I don't have any, but please keep entering the questions. Let me go over a couple of Synergip slides. I'm Pankaj Jain. I'm the VP Software Services at Synergip. I've been Synergip for about 2 years, and you can see my contact information. So if you have any follow-up questions or you want to reach out to Stephen, please do let me know. Reach out to me and then I'll get your questions answered. Next slide, please. So Synergip, we basically work as your trusted co-development partner for agile software development. You get your own dedicated team of software development and QA professionals. Our clients come to us to address one of the business challenges they are facing, basically to accelerate their product roadmap delivery. They want to obviously move faster and faster, but scaling the engineering team quickly is a challenge for them, right? Also, as Stephen mentioned, the technology is improving so rapidly, it's very hard to fill the skill gaps you may have quickly as well, like whether it's in machine learning or big data analytics or .NET, Java, or QA automation. Testing is a big part, as Stephen mentioned, to avoid if you're working in the digital health solutions. A lot of clients come to us on that perspective. And also to minimize the cost and reduce risk, we work with many clients in the digital health space, and where we have signed the BA agreement, so we are all covered from that perspective. And a lot of clients actually starts with us in what we support is a dual shore model, where it's very hard for some clients to immediately say, okay, everybody is offshore. But we do have offices in the United States where people start with the onshore and offshore model, where you have one architect or a lead developer on site with you while working with the rest of the team in India. So next slide, please, Stephen. So as you can see, we have over 120, 130 clients we are working with, and instead of going through all the list, as I clearly mentioned, we work with different clients with different domains using different cutting-edge technologies. And all of our clients are referenceable, and you can check their video testimonials on our website. Key thing for today's presentation is we work with many clients in the digital health space, and we have signed the BA agreements with them, as that is one of the key thing before you even start developing any solution in the digital health. So we have signed many agreements. We work all over, from the mobile app to the big data analytics to the machine learning in the digital health space. Okay, next slide, please. You can connect with us using our Synergip Twitter handle, on LinkedIn, Facebook. I encourage you to follow us. We do monthly webinars and on interesting different topics. Sign up to our newsletter, monthly newsletters. Next slide, please. And the last slide is basically it's our next month webinar, which is on June 20th. And the topic is grassroots innovation in the enterprise. It's a pretty interesting topic, so I encourage you, each one of you, to sign up early. The webinar presenter is Hugh and Jeff, and the webinar will be moderated by Hemant Elhans, who is our CEO and a co-founder of Synergip. And I think at this point, let me check if we don't have any other questions. So at this point, I would like to basically thanks again, Stephen, for a great presentation.
Thank you for having me.
Looking forward to seeing you all in future webinars. And as we said, like this webinar is being recorded, and tomorrow you should receive an email with the recording of the video and the presentation. So thanks everyone, and have a great day. Bye.
Thank you.